Hello everyone, happy afternoon, a very good afternoon. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. Okay, that's great. So here we are with the next set of series targeting the INICET, the upcoming INICET exam. And this would be useful for NEET PG and also for FMG students as well to understand the concepts. In the NEET PG 23 exam, I realized that it's not just completing the theory, completing the notes that is important. It's also very important basically to understand the concepts so that no matter how the question is asked, you are able to answer that. So if you ask me the 3 pillars to crack any exam, I would basically put it the 3 pillars basically that we have to crack any exam. One is concepts. Understanding the concepts is very, very important. And then we have mnemonics, right? Because no matter how much the question is put in a clinical way, but somewhere you have to memorize something. And if you memorize things with the help of mnemonics, it's very, very easy to recall them in the examination hall. And thank you so much for all the messages, like so many messages that I've received post NEET PG exam, that the mnemonics helped a lot in the quick recall, right? So any clinical question, like the question of that clinical image, a lady with allergy to dye, the answer was PPD, but that's again a fact that you need to remember, right? So fact and concepts, they go together. And then comes the MCQ solving skills. This is another very, very important pillar to crack any exam. Now, whatever you do, you also need to learn the MCQ solving skills. So that is what entirely I believe. So my teaching is based on all these 3. And this is where right in the center of the Venn diagrams comes the sessions that I take, right? The lectures that I take are all based on concepts, mnemonics, and the MCQ solving skills. Now, because I had promised before NEET PG that we would do sessions related to first aid, and we really had a lot of time crunch. We could not do it before NEET PG. So we are doing it now. We are starting with the series now. Which is FAST. The series is called as FAST, that is First Aid Simplified Teaching. Now, if you would go and see the USMLE First Aid book, yes, it's extremely important. The content is the same that you must be reading from any other resource. The content is the same. It's just that everything is given in a very, very consolidated manner. And sometimes if you would if you would be reading it by yourself, you might throw away that book because without the foundation, it's very difficult to assimilate that book. So that's why wherein I come into picture, where I would help you read, retain, and recall in the examination hall the important snippets, the tables, the paragraphs from first aid is what we are going to do. So this is episode 1 of First Aid Simplified Teaching. And all the topics that we would be choosing from first aid would be the ones that have been asked in the past exams, right? And why are we starting with physiology today? Because the timetable that I gave you, right? So we have started with the new timetable for students who missed on the live session we had yesterday, the INICET timetable. So we have started it today for 3 days. Starting today, we are going to do physiology. And in these 3 days, I'll also try to do as much as possible, right? With the respective daily targets, I'll try to do the sessions for you guys, where they would be based on concepts, mnemonics, the PYQs, the first aid, and the KBMDs is what we would be trying to do. So this episode 1 today, we are going to do the topic of high altitude response, because I actually saw the previous year questions that have been asked in the recent INICET and AIIMS exam. I will also give you the list of the important topics in physiology that are must do for INICET, right? Everything is what I'm going to share. So high altitude is one such question, and it is asked repeatedly in the INICET exam. The episode 2 of the FAST, basically the first aid, another integrated session for physiology, will be tonight 8 p.m. right? It's going to be tonight 8 p.m. on the Unacademy app. So Vignesh, either it's going to be YouTube or the Unacademy app, and these are like the free live classes. On the app, when you go and enroll for the session, I'll share the link in the comments as well of this session. I've shared the link on the Telegram group as well. So high yield topics, physiology, first aid, and PYT integrated. So I would take up a few more snippets basically from a few more snippets from the first aid. Yes, Meet, we have 3 days for physiology. So one day I would dedicate to solving, a KBMD based on BRS physiology to help you develop more concepts. So next episode is today, 8 p.m. Please do not miss on that as well. And trust me, these sessions are going to help you definitely in your upcoming INICET exam, right? And apart from that, for the offline classes also, I would be planning sessions like the short session for INICET and FMGE. And I would give you an update on that soon, when and where we are planning on that. All right. So, yes, KVMD, सब कुछ आएगा. Okay. So this is the timetable, guys. Please try to stick to this and complete it. Now, what is the strategy to complete the subject? This is another part that I wanted to cover here. I'm not giving you, no, Nikhil, it's going to be free classes on Unacademy. Okay. Strategy to complete the subject. I gave you the physiology 3 days, like medicine 3 days, surgery 3 days. I'm not giving you daily targets. Because what I want you to do, the strategy in this basically would be like, let's say you are starting with physiology today. I don't want you to read it in a prospective manner, but a retrospective manner. So first thing that you should be doing is do all the previous year questions of physiology, starting from 2022, 21, 20, 19, 18, 17, as much as you can do. So day one, dedicate to PYQs, reading the explanations, and also revising the topics that you found that you were not able to recall or you were not able to answer. So you have to take a retrospective approach. So start with the PYQs. That will give you an idea on what topics are important for AIIMS and INICET basically, right? And then you should be reading the important topics, and then you should be reading your weak topics, which you might have realized from the NEET PG exam as well. So that is why I'm not giving you daily targets, because this time for INICET preparation, your approach is not going to be system wise ki chalo physiology ka general padho, respiratory padho, CVS padho. Rather, it is going to be more retrospective. That is more high yield. Okay, that is more high yield. And on the last day of the subject, whatever you have read, please try and keep separate 2 hours for the quick revision of the subject before you go on to the next subject. Okay, that's very, very important. Now, coming to the important topics in physiology for INICET, there are few topics that I would definitely like to highlight for INICET exam. Like action potential ka graph, questions based on action potential, the nerve action potential, the neuron action potential, the cardiac action potential, both of which were asked in NEET PG recent exam as well, right? Depolarization, repolarization, all of that. This we are going to cover in the today's 8 p.m. class. Action potential is asked so many times, it's absolutely important. INICET tends to ask a lot of questions on graphs in physiology, and also the questions on numericals, right? So if you ask me in numericals or graphs में most important questions कौन से हैं? So many times there has been question on the Poiseuille's law, which is related to the flow through a blood vessel, the effect of the diameter and the length. There has been so many times a question repeated on tetanizing frequency. How do you calculate the tetanizing frequency, right? There has been numerical or formula asked of clearance, like creatinine clearance, inulin clearance, the UV upon P wala formula. So you would see a lot of graphs and numericals based question in INICET as compared to NEET PG. NEET PG already had also had a lot of graphs based questions. Okay? Yes, very good. So Dr. Anonymous, correction error. Next point, next topic in physiology, definitely important is your feedback mechanisms. Right, the negative feedback, the feed forward mechanism, what comes under which category? So many times it is asked. The types of transport, that was asked in NEET PG as well, like facilitated diffusion, extremely important. A lot of questions on respiratory physiology. What happens in obstructive lung disease, the graph, the hysteresis, all of that. And then you have oxygen hemoglobin dissociation curve that is asked. The muscle physiology. गोल्जी टेंडन ऑर्गन का फंक्शन 2-3 बार पूछा गया है in the exam. It's extremely important. That's your homework for today, to watch the previous class that I have taken on the Unacademy app. It's a free class. I've shared the link on the Telegram group. Please watch that class. It's extremely important. Right, and of course CVS is important. The Wiggers diagram, the JVP, all of that is important. Right, graphs में आपका Darrow unit diagrams सब कुछ आ जाता है. ठीक है. So these are some topics that I can recollect are asked very frequently. All of this, the important points, the important topics I would try to cover in the today's class at 8 p.m. and in the remaining 2 days as well. Okay, so that is what our strategy would be in these 3 days. Yes, absolutely right. Intracellular connections, the various, intercellular, intracellular connections are also asked very frequently. Okay, so let's start with the discussion of the today's topic is the high altitude response, and this is the topic that has been asked in the recent INICET 2022. Let me show you the question. This was the question that was asked, and that is not seen at high altitude. Which of these is not seen at high altitude? Polycythemia, hypoxia, respiratory acidosis, and pulmonary vasoconstriction. What do you think would be the answer to this one? What do you think would be the answer to this one? Just one thing that I would need from you guys is please to let your friends also know, whoever is appearing for INICET or the next NEET PG exam, so that the maximum people benefit out of these sessions. I think that's the least that I can ask from you, so you can share it in your groups as well. Yes, I'll share the PDF after the class on the Telegram group, Dr. Nikita's Radsynapse. Absolutely right. So majority of you, all of you rather, have got this right. The answer is going to be respiratory acidosis. Now, physiology is a subject that I don't want anybody of you to mug up. It's a subject which is entirely based on concepts. Understanding the concepts is very important. So if I can show you this, this is page number 694 from USMLE First AID, and this paragraph is what we are going to concentrate in the today's live class, that is response to high altitude. And this will also show you that how every line of first aid is important. Just give me a minute. Hello everyone, am I audible and visible now? Yes, that's great. I'm so sorry for that interruption, but actually it was an emergency and our maid had got locked up in the bathroom and she was not able to come out. So that's why I had to rush. And thankfully she's out now. Okay. Chale. So let's start with this, the discussion of this छोटा सा paragraph, but you would realize that how first aid has a lot of concentrated information, and every line is important, right? So first one, response to high altitude. I've shown you the page number as well, right? So इसमें क्या है? What happens at high altitude? This is what we need to understand is, so at high altitude, what happens is, the FiO2 is constant. Please remember this point as well. I will try to highlight that. Yes, so the FiO2, that is the fraction of inspired oxygen, is a constant, right? But what happens is the atmospheric pressure is low. At high altitude, the PB indicates the atmospheric pressure. Now, the atmospheric oxygen is also low. That means the PiO2 will decrease. Okay, so the oxygen ka partial pressure in the inspired oxygen is less because the atmospheric oxygen is less. Now, when that is less, so basically what will happen is, I'll explain everything, just have some patience. So now what happens is, the arterial oxygen will be less. So basically there would be hypoxemia. Okay, there would be hypoxemia and hypoxia in turn. So there is going to be hypoxemia and hypoxia. Now, whenever the oxygen is less in the environment, that is at high altitude, to compensate for that, we tend to hyperventilate. चलो कम है अगर ऑक्सीजन तो ज्यादा ventilate करके we will try to do hyperventilation. So remember that the ventilation increases. Now, when the ventilation increases, what will happen to the CO2 wash out? With hyperventilation, what happens to CO2 wash out? More CO2 will go out, right? So what will happen to the PaCO2? That would also decrease. Okay, that would also decrease because there is increased washout of the carbon dioxide. Now go back to our previous sessions, the discussion of the topic of acid-base disorders, where we have discussed that when the PaCO2 decreases, what acid-base disorder would it be? The respiratory acidosis or respiratory alkalosis. All of you remember the mnemonic, Ramban mnemonic basically for acid-base disorders, Rome. Respiratory is opposite, metabolic is equal. So in respiratory, when the PCO2 is decreasing, pH ka change would be opposite. That means there would be respiratory alkalosis. Okay, there would be respiratory alkalosis क्योंकि PCO2 कम हो गया, तो PCO2 कम हो गया, so there will be respiratory alkalosis. The pH increases since the PCO2 is decreasing, right? So there is respiratory alkalosis. And that is where we get altitude sickness. What are the features of altitude sickness? Headache, nausea, fatigue, lightheadedness, and sleep disturbance. So chronically, there would be increase in ventilation, not decrease in ventilation. When there is hypoxia, we know that it stimulates erythropoietin. Okay, hypoxia stimulates erythropoietin. So there would be increase in erythropoietin. So erythropoietin will tend to increase the hemoglobin because hypoxia stimulates erythropoietin. Right. Now, very important point to be noted, the 2,3 BPG levels also increase. Right. What is the function of this increased 2,3 BPG? Remember that it shifts the oxygen hemoglobin dissociation curve to right. Now remember that in oxygen dissociation curve, shift to right and shift to left. Okay. So shift to right is R for repels oxygen or releases oxygen. Left matlab loves oxygen. So when there is hypoxia, we want more oxygen to be released to the tissues, right? Tissues want it very fast. So there has to be right-sided shift. Now what causes the right-sided shift is the increase in 2,3-BPG. Okay, the increase in 2,3-BPG. So this was another question asked in one of the INICET exam. If you would look at the PYQs, how does 2,3-BPG cause the shift to the right? By binding to beta subunit of the hemoglobin. Which hemoglobin does it stabilize? The deoxygenated or the oxygenated? It is the deoxygenated hemoglobin that it stabilizes. And this deoxygenated hemoglobin is called as what form of hemoglobin? It is the taut form. The taut form is the deoxyhemoglobin. And one of the options said it inhibits the taut form. It does not inhibit the taut form. It stabilizes the taut form of hemoglobin. Remember, this is not dependent on ATP. It is ATP independent. Those were the other options that were there. So basically, there would be increase in 2,3-BPG, which will bind to hemoglobin. And that is how it causes the rightward shift of the dissociation curve. So right for release, there is increased oxygen release, What are the cellular changes? The mitochondria increase. Remember the powerhouse of the cell, unka kaam badh jayega, the mitochondria would increase. When there is respiratory alkalosis, right? We said what is the acid-base disorder? The acid-base disorder is respiratory alkalosis. So what will be the compensatory change for that? How will we compensate for respiratory alkalosis? That is going to be metabolic acidosis. Okay, by metabolic acidosis. So when there's a lot of alkali in the body, what will happen to the bicarbonate renal excretion? How do we get this metabolic acidosis? The bicarbonate excretion increases. Why? Because bicarbonate is an alkali. When there is a lot of alkalosis in the body, we will throw away the alkali from the body out. That is, bicarbonate excretion will increase. So remember, there will be increased renal excretion of bicarbonate, basically to compensate for respiratory alkalosis. And that's the reason that we use acetazolamide in high altitude sickness. A very, very important question, right? So this can be augmented with acetazolamide. Why? Because what does acetazolamide do? What does acetazolamide do? Remember the side effect with acetazolamide? Aceta is acidosis. Aceta causes acidosis, metabolic acidosis. If you remember from our previous sessions, acetazolamide causes renal tubular acidosis type 2, right? The brand name is Dimox, right? The trekkers here must be knowing it. Dimox is there in the bag of the trekkers, high altitude pe jaane wale. So remember, Dimox acetazolamide di causes RTA type 2. So it causes metabolic acidosis basically by increasing the excretion of bicarbonate, and that is why it is used in high altitude sickness. Next, what happens is there is chronic hypoxic pulmonary vasoconstriction. A very, very important concept in physiology that you should definitely remember, that the only vascular bed in our body where hypoxia causes vasoconstriction, not vasodilatation, is the pulmonary bed. So hypoxia causes pulmonary vasoconstriction, right? Very, very important point. Please remember that. It's absolutely important to remember that. Okay. So hypoxic pulmonary vasoconstriction happens when the pulmonary vessels go into constriction. The pressure will increase, right? Constriction means the vascular resistance increases. Dilatation means the vascular resistance decreases. So when the resistance increases, the pressure is increasing. So there would be pulmonary hypertension. When there is pulmonary hypertension, back pressure going to the right ventricle, that will lead to right ventricular hypertrophy. Okay, that would lead to right ventricular hypertrophy. I hope this is clear with everyone, whatever we have learned. So you can see that every line here is important. So let us quickly revise. How is the FiO2? Constant. FiO2 change नहीं हो रहा है, हम normally जो ले रहे हैं ऑक्सीजन वो है, but what is changing is the atmospheric pressure. The atmospheric oxygen is decreasing, and that is why the inspired PiO2 is decreasing. If we are taking less oxygen, the oxygen levels in the blood will be less. So that we will try to hyperventilate. So CO2 washout, CO2 decreases, respiratory alkalosis. Increased erythropoietin will be there, so increased hemoglobin. 2,3-BPG levels increase, so rightward shift is what we would see. Increase oxygen release, mitochondria increase, renal excretion of bicarbonate increases, right, to compensate for that. And that's why we use acetazolamide is the drug here that we give. There will be pulmonary vasoconstriction because hypoxia causes constriction. That will lead to pulmonary hypertension, and there will be RVH. Okay, there will be RVH. Sudeep, with alkalosis, what happens is the calcium levels decrease. Hypocalcemia is what we see with alkalosis, right? Because what happens with alkalosis means, the concept here, why do we see hypocalcemia in alkalosis? Remember this another point we have learned in acid-base disorder. So that is why in alkalosis there can be features of tetany. Perioral tingling numbness can come in. The tetany can come in, right? Why? Because albumin is positively charged or negatively charged? It's a negatively charged protein, right? It wants to bind to positively charged ions. Which are the positively charged ions in the body? H plus. But in alkalosis, what is happening is the H plus is less. The H plus is being used to compensate for that. So what happens is calcium binds to albumin, and that is why the free calcium decreases, and that is why there is hypocalcemia. So calcium binds to albumin, and that is why there's hypocalcemia features in alkalosis is what we need to remember here. Okay, so this is basically the concept here, and let's quickly summarize this. So tell me what will happen to PaO2 with high altitude adaptations. Basically, what are the various changes? Let us quickly revise this. PA, the small a basically stands for arterial oxygen. There is hypoxia, hypoxemia, it decreases. What happens to ventilation? Decreases or increases? जब hypoxia होता है, hypoxemia, we tend to hyperventilate. When we are hyperventilating, a lot of CO2 washout happening. So what's happening to PaCO2? Decreasing. Okay, that is decreasing. So what acid-base disorder if PaCO2 is decreasing? Respiratory opposite, pH increases, so that is going to be respiratory alkalosis. So to compensate for that, bicarbonate excretion will increase. This can be augmented with acetazolamide. Right, what happens to hematocrit and hemoglobin? Increases because hypoxemia stimulates erythropoietin. What happens to 2,3 BPG levels? Logically thinking, we want more oxygen to go to the tissues, increase oxygen release. That is rightward shift of the oxygen dissociation curve. So ODC shifts to the right. What happens to pulmonary vessels? There is pulmonary vasoconstriction. Very, very important. Hypoxia causes pulmonary vasoconstriction. And what happens to the number of mitochondria? It increases. Pulmonary vasoconstriction will lead to pulmonary hypertension, and back pressure will lead to RVH, the right ventricular hypertrophy. Now adding this extra point here, remember that this is the formula for PiO2. Also remember that at high altitude, the hypoxia that is happening. How is the AA gradient with that? Remember the AA gradient, that means alveolar, जो alveolus में से blood में oxygen जा रहा है, the gradient is going to be normal. The gradient does not change because the problem is not at this exchange membrane, right? यहाँ पे कुछ defect नहीं है. The defect is in the incoming oxygen itself is less. Here the membrane is normal. So please remember that high altitude is an example of normal AA gradient because here the PiO2 basically is decreasing. So when the inspired oxygen is decreasing, that happens at high altitude because of the decreased PB. That is the atmospheric pressure. That is what we have. So remember that PiO2 ka formula is FiO2 into Pb minus PH2O. This is the formula for PiO2. FiO2 into Pb minus PH2O, that is inspired oxygen tension is equal to fraction of inspired oxygen, which is generally 21%. Pb is the barometric pressure. You can take it at 760. And then we have water vapor partial pressure. Normal values is 47 basically. Okay, that is 47. So remember, this is the formula. And based on this PiO2, you also get the alveolar gas equation, where if you are asked to calculate PaO2, that is the alveolar PaO2, it is PiO2 minus the PaCO2 upon respiratory quotient. Okay, upon respiratory quotient. Yes, absolutely right, Zen mode. In ILD, the AA gradient will increase. It will not decrease because the oxygen from the alveolus is not able to go into the blood. So a lot of this will be in the alveolus itself. The gradient would increase, or rather, there would be a lot of difference in between the two. So respiratory quotient also has been asked in the previous INICET exam. Calculate the respiratory quotient coefficient. So remember that it is CO2 upon oxygen. How much CO2 is produced in response to the oxygen consumed? So CO2 upon the oxygen is the formula for respiratory quotient. FiO2 Pb minus 47 is the normal value that you can take here. Okay, so remember this formula as well. You can add on to your notes. And now going back to the question that we saw in INICET 22. Now I'm pretty sure that all of you know the answer to this. Not seen at high altitude, polycythemia will be there because there would be erythropoietin which is stimulated by hypoxia. There is hypoxia for sure. Hypoxia in turn will cause pulmonary vasoconstriction, and there would be polycythemia. Respiratory acidosis will not be there. There would be respiratory alkalosis since there is hyperventilation. Okay, since there is hyperventilation. Okay, so that was a discussion for the today's topic. As FiO2 is constant, but remember that what is changing in this formula is, that's what we are saying, the Pb is decreasing. The barometric pressure is decreasing at high altitude. At a high altitude, the FiO2 is constant, but the Pb is decreasing. And that is why the PiO2 is decreasing. So next time if you get the question, which of the following remains constant at high altitude? It is the FiO2 which remains constant. The Pb is decreasing. That's why the PiO2 is decreasing. Okay, that's why the PiO2 is decreasing. Is that clear? Right. So I hope you have understood this topic of high altitude response. It is an extremely important and a frequently tested topic. Remember, the drug of choice here is acetazolamide because it leads to metabolic acidosis, the compensation to respiratory alkalosis. So when are we meeting next? More such topics, integrated first aid and PYQs, we are going to see in the next episode at 8 p.m. today. Where we would see a lot of other snippets from first aid, right? So in these 3 days, we'll try to do as much physiology as possible. So see you at 8 p.m. for the free live class on Unacademy app. Enroll for it right away. You can use the code Dr.Nikita when it asks you for the unlock code, and I'll see you at 8 p.m. Please follow this strategy to complete the subject. First do the PYQs, the PYTs, and then the rest of the topics, and focus on the important topics, the most frequently asked topics. Okay? So yes, these are the free live classes. So Zen Mode, it's a free live class that's going to be there at 8 p.m. on the Unacademy app. I'll share the PDF on the Telegram group post this class. Monimala, you'll get the PDF very easily on the, just search in Telegram first aid ka PDF, you'll get it very easily. Don't want to get into that, someone sending me a copyright or bar, so I'm not sharing it directly. Chalo, thank you so much everyone. Goodbye, take care and keep studying.